Hello, I'm Sulin and welcome back to another star-studded episode of HBW-TV. Today, we're here at the gorgeous Penang Golf Club and we would like to welcome back Dr. Jack, the amazing plastic surgeon with a lot to tell us. So last episode, we talked about what is plastic surgery on a whole, and this episode we'll be focusing a little bit more on cosmetic surgery, one of the 8 textbooks that you mentioned. So doctor, could you tell us, what is cosmetic surgery?
Okay, so cosmetic surgery again comes back to the definition of what I mentioned before, roughly, I guess. It's taking something that is already normal and trying to make it better than normal. So that's the basic idea of cosmetic surgery. So that's the overall big category of it. Then of course, then cosmetic surgery is defined by a lot of other things as well. Which I would say the main thing about cosmetic surgery is it's very cultural based. So like if you go to US, for example, it's very different. If you go to Korea, it's very different.
Okay.
If you talk about cosmetic surgery here in Malaysia, it's got its own challenges, it's very different as well. So here we have a big mix of different races. And each race has got its own demand of a particular type of cosmetic surgery.
Okay.
So it makes it relatively challenging because we are not defined to one particular type of category. So there are those who come, they want the mommy makeover.
The mommy makeover?
The mommy makeover? You never heard of it? No? Okay. So mommy makeover is basically a woman who has had babies or who has had children, and now she wants to get her saggy skin and the abdomen fixed. She's got a little bit of a droopy breast, so she wants to fix those. She wants a bit of lipo and things like that. So that's one category of people here. It's very famous in the Caucasian or the American or the Western societies. Mommy makeover is the big thing. Day in, day out, all the plastic surgeons do is only that. Whereas for us in Malaysia, it's very different because in Malaysia, you got the different categories. You got the Chinese individuals who want to look like Koreans. So they have very different set of demands, a different set of surgeries that are
So like
double eyelids. They want your nose done. Whereas you will never find you wouldn't find a lot of Malay individuals coming in to get a nose done, and also Indians as well. So then, of course, we've got medical tourism happening in Malaysia as well. So we have a lot of Indonesians coming in, we have a lot of Australians coming in, Western society expats coming in. So it is quite challenging in that sense. You have to really tailor the cosmetic surgery to the socio-economic status of the particular individual and also their background. So overall that's cosmetic surgery. Then you have in that scope of cosmetic surgery is also non-surgical procedures.
Okay.
Like your Botox, your fillers, and things like that. So that also comes under the category of cosmetic surgery, kind of, in the whole umbrella, yeah.
What, do lasers fall in that category? Because we'll be talking about lasers in a few minutes.
So lasers are not exactly surgery. It's more of a cosmetic procedure or cosmetic indication to do some lasers.
Okay.
A lot of lasers are non-cosmetic based, so there are some laser procedures that are done that are based on cosmetics, trying to improve someone's appearance. There are those lasers that are done to do other things like remove a mole, or in fact other surgeons use laser for a lot of other things as well, removing tumors and things like that. So laser is a very big category.
How do you find, as a plastic surgeon, the ease or difficulty in specializing in one certain area of cosmetic surgery? And what would you say is the most popular kind of cosmetic surgery in Malaysia?
So with regards to the question, yeah, there are only about less than 100 plastic surgeons in the whole of Malaysia. So you're talking about a population of maybe 30 million odd people, and only 80 of us in the whole country. If you look at Seoul, for example, they have about a population of maybe 30 million, Seoul alone, and they have about 3,500 to 4,000 plastic surgeons. So you're talking about a big difference. So, okay, so our work, we have our work cut out for us. So I guess the difference would be if you are in a government service or a government practice in Malaysia, most of your work is going to be reconstructive plastic surgery. A lot of pediatrics, a lot of burns, plastic surgery, pediatric as in children. Cleft lip is another big thing that you would be doing in the government hospitals. When you come to private practice, it's very different. Private practices, the challenges of a plastic surgeon is a bit more unique in the sense that you have big hospitals you can choose to work in, or you can choose to set up your own clinic as well. So these are the few different avenues that a plastic surgeon can be found in. Okay, so if if you're in a private practice, majority of your work is going to be cosmetics. a lot of the reason why a lot of your work in private practice is cosmetic as well is because of insurances as well. So a lot of private practice nowadays, especially in hospitals, are insurance based. So that's a difference there as well. So, but I guess most plastic surgeons in private practice would go towards cosmetic surgery because it's challenging, it's interesting, it's a lot of fun. You meet a lot of interesting people, and well, that's where the whole I guess that's where the revenue is as well.
You know, maybe a decade ago, we had places that purely offer facials, and then if you wanted to go get a surgery, you would look for a doctor. But nowadays, the line is getting more blurred. You have, aesthetic places or beauticians offering, more and more advanced treatments and maybe even surgeries at some point. So where exactly is the line in this whole sea of grey?
Okay, so let's look at the different setups that are available in Malaysia. Okay, so now I guess you can break it down to the medical practitioners of cosmetics and the non-medical practitioners of cosmetics.
Okay.
So a medical practitioner of cosmetics, for example, okay, let's start with the the family doctors or the general practitioners who do aesthetics.
Okay.
So they are called aesthetic physicians. Okay, so for them to be aesthetic physicians, they need a special license, which is issued by the Ministry of Health. Okay,
like a doctor.
No, they already have a doctor.
Okay.
They are doctors. They are full-fledged doctors.
Okay.
110% they are full-fledged doctors. They graduated from med school. They're fully qualified medical doctors. But they have not gone through a specialization process. That means they're not a surgeon, they're not a physician, they're not a cardiologist or anything like that. So they are general practitioners. They're basically GPs, general practitioners. So they have decided to go into the path of aesthetic medicine. So they go into further training. The training is not regulated in Malaysia, but there is a license that they need to procure. So that license, the procurement of that license involves a certain set display of training that they have done, and then they get the license. So then that deems them as an aesthetic physician or aesthetic doctor, if you want to put it that way. Then comes the next category of specialized people like us, who are plastic surgeons, who are dermatologists, so skin doctors. So we are the next category of aesthetic or cosmetic practitioners. So of course, in our scope for the plastic surgeon, for example, we can do whatever the dermatologists or the aesthetic physicians do, on top of the fact that we do surgery as well. So that's the difference in the category of things. So the aesthetic physicians are not surgeons. So in their license that they get from the ministry, they have very set defined things that it's very set defined category of procedures or things that they can do. Same thing goes for the dermatologist category, that means the non-surgeon categories, and then the surgeon categories. So that's where the difference comes in. So that is the aesthetic, the so-called the doctor realm, or of practitioners. Then you got the beauticians or the beauty centers.
Okay.
So the beauty centers are the ones that now they are non-medical individuals. They don't have any medical training under them. So they, by right, they have a very clear, defined role to play, and what their so-called setup can do or cannot do. There is a very clear-cut guideline that is issued by the Ministry of Commerce, where it's a guideline of what machines that they can have in their setup and what they can or cannot do. So when it comes to doing facials and doing your nails, manicure, pedicure, and things like that, of course, that's also beautician work. Certain things like blackhead extraction and things like that, of course, that is fine. But when it comes to doing surgery and doing injections in the beauty centers, that is nowhere are those procedures in their category of what scope they are supposed to do or not supposed to be doing. That's not legally what they're supposed to be doing. Yeah. So I know there's a huge following out there on social media. If you look at some of the centers, some of the beauty centers, they're offering services at really cheap prices, and these services are supposed to be only done in the realm of the medical doctors, but they're offering the same services as well. It's not really legal. No. It's not legal at all, actually. Yeah.
So for the general public, how would someone be able to tell whether someone can get a procedure at one place or they should get another? Or better way to phrase it, what procedures off the top of your head fall into limited to surgeons, limited to aestheticians, limited to beauticians?
Okay, so let's talk about the first category, like the whole medical industry, for example. Okay, so it comes back down to the definition. who is a surgeon, who's not a surgeon. Okay, a dermatologist is not a surgeon. A family doctor, a GP, is not a surgeon. Okay, so the plastic surgeon, yes, we are surgeons. We have other categories of surgeons, ear, nose, ENT surgeons. So there are a lot of categories of surgeons. So of course, plastic surgeons, like I said, we've been in the forefront of cosmetic surgery. We learned that as part of our training. So surgery should only be done by a surgeon in a proper surgical facility, a proper surgical setup. Okay. So Ministry of Health has got a very, very, very strict guideline of what defines an operating theatre, what is a minor operating theatre. So when we set up our centres, we adhere to all those regulations. Now, if you look at a GP clinic, for example, so how would a person of the general public know that she's having surgery done in a GP clinic or not? Okay, so I'll give you an example of just a patient I had just two days ago. So she had a nose job in a GP clinic, and only after having the nose job done, and when something went wrong, she went and checked back the credential of this doctor. She's nowhere in the category of a surgeon. But she had a nose job done, which is a big surgery to put in an implant in the nose. So these are the kind of things that are not supposed to be done by GP practice, and that is not in the scope of their license for aesthetic practice. That's in the scope of the license of the plastic surgeon. Even the dermatologists don't do that kind of those things, you see. So that's where the difference comes in. So it comes back down to the definition of surgery. If you are having surgery for a double eyelid and things like that, it's not supposed to be done by the GP category. Okay, so that's the medical side. Now when it comes to the beauty centers, surgery is out the window. No, beauty centers are not supposed to be doing surgeries, full stop, lock, stock, barrel. No surgery in beauty centers. Now what if you ask me, okay, what if the beauty center has got a surgeon coming in there and doing surgery? No, it's absolutely not allowed as well, because if you look at Ministry of Health guidelines, you need to have a very set precise area where surgery can be performed. There are a lot of risks involved in surgery. Infection, who is doing the surgery, for example. You see, I always ask my patient, I say, look, if this guy is so famous in China, if this surgeon is so famous in China, why is he coming to Malaysia to do surgery? In a beauty center? Why is he not doing surgery in a big hospital? You know, so that's always the question that the public needs to ask themselves before they go into this kind of setups. You see, I've engaged a lot of people, and they all say that for the majority of people that I know, they have procedures done in beauty centers. And why is that so? I don't know per se, but I feel it's actually the environment that the beauty centers sets up for them.
Very fancy.
Very fancy, they speak the right language. Oh, you look so pretty, like, maybe you should do the nose, maybe you should do this, maybe you should do that, why don't you do this? We have a very good surgeon coming from Taiwan, he's so famous, it's not a big deal. See, I've done it myself. I think that's one of the biggest false idea that a lot of people have, that, oh look, this person has done the nose from that particular surgeon, so I'm going to have the same type of nose. But actually that's not true. No, because if you look at the ratio, say for every 5 surgeries that happens in a beauty center, you might get 2 or 3 that go bad. So you're talking about 3 who are good, 2 that have gone bad. Okay, so now that ratio of 20 to 30% complication of problems is not acceptable at all.
Yes.
So every time a lot of patients who come in after going to beauty centers and have problems, they always say, oh, my sister-in-law did it, my cousin did it, hers is fine, mine went wrong. I say, yeah, well, you happen to be one of those 2 or 3 out of 5 that had the problem.
It's like a Russian roulette kind of game.
Exactly, so you're on the risk, you see. So do you want to take the risk of being 20, 30% or even 50% having problems? Well, as the surgeon, we can minimize that. The whole idea of doing it, getting it done by a surgeon, is to minimize that risk. I'm not saying surgeons are perfect as well. We have our own problem. There's no such thing as a perfect surgeon, you see. So but we minimize the risk. We know how to bring it down to 5%, 2%, 3%, 1%. That's where the difference comes in, you see. So that's where the difference comes in with the training, with the qualification, the understanding of the procedure, the environment of where the surgery is going to be done, is to minimize the risk and bring it down. So that's the biggest thing that the general public should realize. And I think that's the biggest message I think I would like to say here.
Thank you very much, Doctor, for enlightening us a bit more about the cosmetic surgery industry. Join us on our next episode where we talk a little bit about lasers and how they span the different industries.